day everyone, I am Siti Rayhan Amante, and in this video I'm going to perform assessing the nose and sinuses.
Inspect the external nose. Note size, shape, color, and flaring or discharges from the nares. This is to distinguish the normal findings to deviations from normal. Lightly palpate the external nose. This is to assess for area of tenderness. Instruct the client to close his mouth, occlude one nares, and breathe through the opposite nares. This is to determine the patency of both nasal cavities. And then repeat the procedure with other nares. This is to determine the difference in any abnormalities. Use a nasal speculum and a pen line to inspect the nasal cavities. To clarify and assess the nasal cavity, hold the speculum in your right hand to inspect the left nostril and hold it in your left hand to inspect the right nostril. This is to assess the right and left nostrils properly. Ask the client to tip his back, brace your index finger against the client's nose, and gently insert the nasal speculum about 1 cm into the nares. Open as much as possible. This is to have an easy view to check the nasal septum. With the pen light, shine into the nares. This is to inspect the nasal mucosa and any edema, testus, inflammations, glow, or discharges. Inspect the nasal septum for position, deviation, and intactness. This is to determine any abnormalities. And then gently remove nasal speculum. Wipe it dry with a tissue or a gauze. This is to prevent the spread of microorganisms. And repeat on other nares to evaluate with nares. Facial sinuses. Palpate the maxillary and frontal sinuses. This is to assess for any tenderness. Frontal sinuses. Shine a pen line against the inner aspect of the supraorbital ridge of the frontal bone. A red trans illuminates in the sinus. Absence of it nodules, a sinus filled with fluid or pus. Maxillary sinuses. Instruct the client to open his or her mouth and shine the pen line to the left and right. Observation, assess, and for easy data collected. And that's it for today's video.